Welcome back to Carolina Journal Radio. I'm Donna Martinez. Well, there's no shortage of complaints about the high cost of health insurance and the high cost of health care itself, but there are ways for North Carolina lawmakers to help lower the costs. And interestingly enough, it has nothing to do with Obamacare, the Affordable Care Act. Jordan Roberts is the healthcare policy analyst for the John Locke Foundation. He's been writing about this. He joins us now with the details. Jordan, welcome back to the show.
Thanks for having me.
You are writing that we must pay attention to the 53. What are the 53?
So those are the amount of mandates that the state of North Carolina says that if you're a private insurer and you're going to offer a product in this state, you must provide coverage for these 53 different sets of, services or procedures or protections, coverages, things like that. And so, over time, these have built up to a number, very high. And, it's something that private insurers have to deal with when they want to come into the state and offer a product is these 53 mandates.
What impact does a mandate then have on the cost? How does that work if I'm an insurance company and I'm pricing my product and I take a look at everything that's required?
Yeah, so when you're looking out, you're designing a benefit program, you look at what the state tells you have to cover, and then you incorporate that into your health benefit plan. And so what that means is then you then have to go out and find a provider who offers that service, and you contract with them. They become an in-network provider. But what this does to the entire health benefit plan is that all the covered lives in there, it's concentrated benefits and diffuse costs. So what that means is that the benefits that each of these mandates convey is only to a small population, but the costs are spread out over the entire health plan. So for each mandate that the state adds on, we each pay a little bit more to ensure that coverage in the health plan.
Jordan, if you take a look at some of the items on the list, and by the way, Jordan actually has posted the list of these 53 state health benefit mandates. You can find them at johnlocke.org. If you scan the list, Jordan, you see things that clearly if you know someone who is suffering from a particular diagnosis or a problem, it really does bring up the emotion in you. And is that how these mandates get added to the list, because there's such a compelling emotional story attached to someone who is afflicted with a particular problem?
Yeah, that's exactly what happens. And, we refer to this as the special interest effect. And so essentially what happens is, well-organized trade associations or things like that are able to, effectively lobby the state legislators to say, this is an important issue, and I have a group of, supporters that, this is an important issue to them, so therefore you should mandate that health insurance, cover this. And so that's how it happens. It's a tough sell to say that these people right here standing in front of you will benefit from this, but what is hidden is the costs that are spread out to everyone. So while these do help a small individual amount of people, what it does is it decreases the competition among health insurers, because if each health insurer has to provide that benefit, then there's no meaningful difference between, the companies that are offering products, and they can't compete for your business. So, that's where we get these inflated prices and, no real competition in the insurance market.
Has there been any research, Jordan, on how benefit mandates impact the costs? I mean, you've talked anecdotally, and it makes perfect sense. If you're the insurance company, the more you are required to cover, then the higher you're going to have to price your product in order to make sure that you are adequately prepared to deal with all that. But is there research that shows that indeed is how it plays out?
Absolutely, yeah. This is, this. As soon as the Affordable Care Act was put into place, they had what they called the 10 essential health benefits. And, that was a big deal, was that, Obamacare required that every health plan sold on the Affordable Care Act exchanges and most other employer plans have to cover these 10 essential health benefits. And research shows that, a large portion of the hikes in health insurance is directly attributed to those mandates, because when health insurers are, forced to provide this, then they have to spread those costs costs around to all of us, and we pay for that. So it's minuscule, but they add up over time, and as more benefits are added on, and health insurance looks similar from company to company because they have to provide all the same benefits.
It's interesting you would mention Obamacare, the Affordable Care Act, because it has its own 10 essential benefits, the mandates there, but those are completely separate from the 53 we're talking about at the state level. So it's really two levels of these cost drivers that have been added in.
Yeah, and imagine being an insurance company trying to operate in this market where the federal government's telling you have to provide all these benefits, the state government's telling you have to provide all these benefits. You need to go build an adequate network to have people come in and buy your plan and say, I'm going to get all the care I need, and that messes up the insurer's ability to freely negotiate with private providers because the providers know they have to provide that. It messes up negotiations, and we all end up paying more is the bottom line.
Jordan, the pushback on the view that benefit mandates are cost drivers is, well, you know what? What's someone supposed to do if they have a diagnosis like this? Will the market take care of that, Jordan? If someone has a particular thing that's going to be quite expensive to treat, will there be players in the marketplace that crop up because there essentially is a demand for a particular type of care and coverage?
Yeah, I believe so. I mean, what we see in a free market is where there's a demand, it's going to be met in some way. And so if we got the state government out of regulating the business of insurance and just allowed, any type of health insurance product to be offered, people would have choices and could view the plans that best fit them, and so health insurers would have options, way more different levels and degrees of intensity of plans that you could buy, and there will always be people that have these certain deficiencies or problems that need to get treated. So, allowing the market to freely meet that demand is how you do it, rather than mandating and having all of us pay and, messing up the free exchange or free negotiations that health insurers have with providers.
Jordan, I think one of the most interesting details in your writing about this has to do with the state health plan, because you point out something that people may not realize, and there are tens, even hundreds of thousands of people covered by the state health plan, right? State employees. Yep. How did the benefit mandates affect them and their costs?
So when a plan is self-insured, meaning that the plan sponsors assume all the risk, they don't pay premiums to an insurance company, the self-insured plan is not subject to any of the mandates from the federal or state level. But, here in North Carolina, we do have a large self-insured state health plan, and, it being the largest purchaser of health insurance in the state, unless explicitly said through statute, these benefit mandates don't apply to the state health plan. And I think the one reason is that legislators realize that these impose extra costs when you regulations get passed on to consumers in the form of higher prices. And so there's this discussion about when Obamacare was going through whether members of Congress would have to join or not. It's the same thing. They know it's not an adequate product, and they know that these benefit mandates raise the prices for everyone, and they're included in that price. So it's an interesting little tidbit there.
It really is. And you can find that interesting tidbit in the piece that Jordan has written about this. It's titled Health Benefit Mandates. All you need to do to get it is just go to johnlocke.org and then go into the search box. You can either put in Jordan's name, Jordan Roberts, or health benefit mandates. You can take a look at those 53 state mandates yourself and see exactly what is required by the state of North Carolina. Jordan Roberts is healthcare policy analyst for the Locke Foundation. Thank you, Jordan.
Thanks.